Estrogen is a hormone primarily associated with the development and regulation of the female reproductive system, although it also plays important roles in both males and females. It belongs to a group of hormones called steroids and is produced primarily in the ovaries in women, with smaller amounts being produced in the adrenal glands and fat tissues. Functions of estrogen. Development of female reproductive organs. Estrogen is responsible for the development of female secondary sexual characteristics during puberty, including breast development, widening of the hips, and the growth of pubic and underarm hair. Regulation of the menstrual cycle. Estrogen plays a key role in the menstrual cycle by stimulating the growth of the uterine lining, endometrium, during the first half of the cycle. It also helps regulate the menstrual cycle by interacting with other hormones like progesterone. Maintaining bone health. Estrogen helps to maintain bone density by inhibiting the activity of cells called osteoclasts, which break down bone tissue. Therefore, estrogen deficiency can lead to an increased risk of osteoporosis and bone fractures, particularly in postmenopausal women. Cardiovascular health. Estrogen has a protective effect on the cardiovascular system, helping to maintain healthy blood vessel function and reduce the risk of heart disease. It can also help to maintain healthy levels of cholesterol in the blood. Brain function. Estrogen receptors are found in various regions of the brain, and estrogen plays a role in cognitive function, mood regulation, and memory. Estrogen levels fluctuate throughout the menstrual cycle, and changes in estrogen levels can influence mood and cognitive function. Reproductive function. Estrogen is essential for the growth and development of the follicles in the ovaries, which contain the eggs. It also stimulates the production of cervical mucus, which helps sperm to travel through the female reproductive tract. Skin health. Estrogen helps maintain skin hydration, elasticity, and thickness. It also stimulates the production of collagen, which gives skin its firmness and elasticity. Decreased estrogen levels, particularly during menopause, can lead to dryness, thinning, and wrinkles in the skin. Regulation of estrogen. Estrogen levels are tightly regulated by a complex feedback system involving the hypothalamus, pituitary gland, and ovaries, in females, or testes, in males. The hypothalamus releases gonadotropin-releasing hormone, GnRH, which stimulates the pituitary gland to release follicle-stimulating hormone, FSH, and luteinizing hormone, LH. FSH and LH then stimulate the ovaries to produce estrogen. In females, estrogen levels fluctuate throughout the menstrual cycle, peaking just before ovulation and then declining if fertilization does not occur. During pregnancy, estrogen levels rise significantly to support fetal development. In males, estrogen is produced in smaller amounts by the testes and is important for sperm production, sexual function, and bone health. Overall, estrogen plays diverse and essential roles in the body, influencing not only reproductive function but also bone health, cardiovascular health, brain function, and skin health. Maintaining hormonal balance, including appropriate levels of estrogen, is crucial for overall health and well-being. Estrogen in men versus women. Estrogen plays important roles in both men and women, although the levels and functions of estrogen differ between the sexes. Estrogen in women. Primary source. In women, estrogen is primarily produced in the ovaries, specifically in the ovarian follicles, which are small sacs that contain the developing eggs. Estrogen production occurs predominantly during the reproductive years, with levels fluctuating throughout the menstrual cycle. Reproductive function. Estrogen is crucial for the development and regulation of the female reproductive system. It stimulates the growth of the uterine lining, endometrium, during the menstrual cycle and plays a key role in ovulation. Secondary sexual characteristics. Estrogen is responsible for the development of secondary sexual characteristics in women during puberty, including breast development, widening of the hips, and the growth of pubic and underarm hair. Bone health. Estrogen helps to maintain bone density by inhibiting the activity of osteoclasts, cells that break down bone tissue. Therefore, estrogen deficiency, particularly after menopause, can lead to osteoporosis and an increased risk of fractures. Cardiovascular health. Estrogen has a protective effect on the cardiovascular system, helping to maintain healthy blood vessel function and reduce the risk of heart disease. Mood and cognitive function. Estrogen influences mood, cognitive function, and memory. Fluctuations in estrogen levels throughout the menstrual cycle can affect mood and cognitive function in some women. Reproductive cycles. Estrogen levels fluctuate throughout the menstrual cycle, peaking just before ovulation and then declining if fertilization does not occur. During pregnancy, estrogen levels rise significantly to support fetal development. Estrogen in men. Primary source. In men, estrogen is produced in smaller amounts primarily in the testes, specifically through the conversion of testosterone, the primary male sex hormone, into estrogen by the enzyme aromatase. Small amounts of estrogen are also produced in other tissues, including fat cells and the adrenal glands. Reproductive function. Estrogen plays a role in sperm production and maturation, as well as in maintaining sexual function and libido in men. Bone health. Estrogen also plays a role in bone health in men, although to a lesser extent than in women. Like in women, estrogen helps to maintain bone density and inhibit bone loss. Cardiovascular health. Similar to women, estrogen has a protective effect on the cardiovascular system in men, helping to maintain healthy blood vessel function and reduce the risk of heart disease. Brain function. Estrogen receptors are present in various regions of the male brain, and estrogen may influence mood, cognitive function, and behavior in men as well. Overall, while estrogen is traditionally considered a female hormone, it also plays important roles in male physiology. Both men and women require appropriate levels of estrogen for optimal health and well-being, although the specific functions and regulatory mechanisms may differ between the sexes.